Thank you very much for coming in and talking to us. I was hoping that you could introduce yourself to us and tell us about your topics.
Yeah, my name is Jeannine Moga. I'm a clinical social worker. I work at the College of Veterinary Medicine at NC State University and also in their veterinary hospital. I am here to talk to you about mental health in the field of veterinary medicine, and also talk to you a little bit about how we can really address more openly the issue of suicide risk in the field.
Excellent. That's a topic that has touched my life directly. And I'm really glad that we're opening the discussion about mental health and specifically about suicide risk in the community, in our veterinary community. And depression is definitely an issue, compassion fatigue, and wellness. So that's been something that we've been focusing on. Do you have any specific wellness tips that you use in your life that you think would translate to the rest of us?
You know, I think one of the most important things we can do is learn how to really intentionally use our brain and our breathing in order to support our mental health, because everything starts in the brain. It's the command center for everything that we are and everything that we do. And that's where we also get into a lot of trouble. So we are professional thinkers. It's what we do every day, and we can get really lost in our thoughts. And it's very challenging then to stop the constant cycling and stop the worrying and stop the rehashing and rehearsing that comes out of being a very busy professional. And it's not just something that we do when we're at work, we do it when we're at home. We do it about our family lives, we do it about our personal concerns. And so learning how to work with our thoughts and learning how to work with our brains is really important to balancing out the stress of the work and giving ourselves a bit of a break so we can find the pause button.
What's a takeaway tip for putting a pause in there and stopping that cycle?
Breathe.
Breathe.
Breathe, which, you know, a deep belly breath will kick in the parasympathetic nervous system. It actually cues a relaxation response. It gets your higher brain back engaged. When we are frenetically busy, really overwhelmed, we are not operating with all of our best tools on board, because we actually are bypassing the neocortex in our brain. So breathing will cue a relaxation response. It actually gets you out of your amygdala and back into your higher brain so you can think clearly, so you can consider if really what's going on is high risk or not. Should I be as concerned as I am right now? And then you can think your way through it and problem solve.
Interesting.
Yeah.
And how do we set up that trigger for ourselves so that we know to take that breath? How do we teach that?
Practice. Practice, 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 just like anything else that we do, that we have to learn to manage and master such that it becomes an automatic behavior. So when you can feel the tension, what I often tell veterinary students is when you can feel the tension building, and when you realize you haven't breathed deeply, to stop what you're doing for just a moment and take 2 or 3 deep belly breaths. Make sure that your abdomen is rising and falling with the breath, and then proceed with what you were doing. So learn to manage in your body and recognize in your body when the stress is getting to be too much.
That's an interesting segue to just being aware that there's a problem in the first place.
Yes.
And I think that that's one of the areas that I've seen my coworkers get into trouble is that they're not necessarily aware that there's a problem until they're in fatigue, until they're in trouble.
Yes.
And so my hope is that by opening up this conversation, by people talking about this and this being a more approachable subject, that people will be able to have that self-awareness.
Yeah, absolutely. And I think when we're in a profession where overwhelm and chronic busyness and the desire to serve is always at such a high level, this sort of pace and this sort of stress almost becomes a badge of honor. Which is not healthy for any of us, but then it makes it very difficult for us to check in with ourselves about, is this really normal? Am I doing as well as I think I'm doing just because I'm working 12 or 14 hours a day and getting through my cases and managing my patients as effectively as I can? Am I at the top of my game? And I think we get so used to being tired and so used to being harried that it's hard for us to recognize that that's not the normal state of the body. And so really talking about it and getting people to recognize that the body has a warning system, and it has an exquisitely detailed warning system in place, and it drops feathers of awareness, like, out of balance, and then it'll lob a brick, and that's when we start getting sick. It's when we start missing cues. It's when we start making medical errors, snapping at our colleagues, losing our patience with really difficult clients. And those are the big warning signals as they start to build up. That's when we're really in trouble.
What are a couple of those feathers? What are some of the things that you notice that people are missing more often than not?
Yeah, distraction. So when the brain is overwhelmed, it can't focus. So when we feel like we're doing so much multitasking that we're not getting anything done effectively, that's a stress response. That's not just that the workload is high. It's a stress response when we can't concentrate. When we aren't able to derive as much joy out of the things that normally bring us joy in our personal lives or even at work, when we are not able to pay attention to and hold on to the successes that we have when we send a patient out the door and they're better. We're focusing on the patients we're losing or the patients who aren't recovering the way we hope they will. That's a sign that we're out of balance. We're starting to lose our grip. If we can't find something to be grateful for at the end of a day.
Gratitude is really important.
It really is, and it's a protective factor. For all of us, it's a hugely protective factor, and there's a lot of research actually in positive psychology that shows that if we can really make gratitude part of our daily practice, it will insulate us against stress. So if we're losing the capacity to find something to be grateful for, that's a really good early indicator that the brain mechanisms are shifting.
Interesting.
Yeah.
So being able to, can we make a positive shift by actually intentionally being grateful during our day?
Yes, absolutely.
Excellent.
So the great thing about the brain is that it's constantly changing and constantly growing if we are utilizing it as the organ it is. So if we're constantly challenging ourselves, and one of the ways we can challenge ourselves when we're stressed out is to force ourselves to find something to be grateful for. Even if it's a colleague who stepped in and brought us a cup of coffee in the middle of a very busy day, or brought us lunch because we didn't have time to run out. You know, someone who pitched in, someone who spotted for us because we couldn't get home in time for someone's soccer game, right? So being grateful in the moment and really forcing the change in the channel in the brain to say, yes, this is difficult, and.
That's really good advice.
Yeah.
Yes, and is a really...
Yes, and.
Yep.
Instead of
Absolutely.
yes, but, or never mind, it doesn't matter.
Yeah, yes, and always opens up the, it opens up the story. It's
It
what
does.
They teach you in improv.
That's right.
Yeah,
Yeah,
absolutely.
yeah.
And I wanted to ask you what your tips are on balance. How do we, and can we, this has actually been a discussion that has been opened up recently, is that as caregivers, can we actually achieve balance? It almost seems like it's this thing that's insurmountable to us as caregivers.
I think our definitions of balance are probably pretty outdated. When researchers were starting to look at work-life balance 20 years ago, 30 years ago, we didn't have the technological tethers we have now. We are all connected all of the time to work, whether we like it or not, or even recognize it or not, right? So we've got smartphones. I have 3 email accounts that ring in on my smartphone, for heaven's sake, right? People can reach me all of the time, even though I'd rather that they not reach me all of the time. So we are always tethered to these kinds of things that keep our brains cued to the things that stress us out, even though they also bring us pleasure and joy and a great sense of satisfaction. And so one of the things that we can do is try to put some limits on that kind of stimulation. So recognizing that, you know, people are on call, so you need to sometimes sleep with your phone next to your bed, but not every day. You don't need to do this every day. And there are times when you can shut the email down and say, from this time to this time, I'm going to silence all of that on my phone and put my phone in another room. If I'm not on call, I'm not answering. And so that has been really helpful to me to have some boundaries around my practice and my personal time. And then to make sure that I always have backups such that if I'm not available and feel like I really need to disconnect, that I feel like my clients are taken care of. And so just making sure that I have that plan and then disconnecting myself from the phone. And then also at the end of the day, because for many of us sleep disruption becomes part of the feather that lets us know that we're out of balance because our brains forget how to shut down and go into sleep mode. So one of the things I always tell students, and one of the things I'm really cautious about myself, is making sure that all screens, technology, computers, everything gets powered down at least 60 minutes before I go to bed. The blue light on screens actually disrupts the release of melatonin, and so it's hard for us to fall asleep.
There's a lot of myth and it just confusion surrounding compassion fatigue just by itself, let alone suicide. Is the risk as high as we're being led to believe? Is it not as bad? Where are we?
Well, so we have a lot of data that's been coming out probably for the last 10 years now, that really is starting to indicate that we need to have more open conversation about suicide in this field. And so I think when the data started coming out, there was a lot of chatter in the field that maybe it's not as severe as we think, and maybe the numbers aren't correct. Maybe the science isn't as solid as we'd like it to be, so therefore we're not going to have these discussions. And really we have lots of studies now starting to build up that are indicating that in veterinary medicine we do have a much higher risk of suicide than the general population, that of the helping professions it does have one of the highest risks of suicide as well. We do know that now we have pretty high rates of psychological distress within the field, and particularly for younger practitioners and female practitioners. And so we're also starting to look a little bit at what veterinary students are coming in with, recognizing that actually we might have some predisposition to psychological distress and mental health issues as people are coming into the field. So we have very high-performing, perfectionistic people who are really driven. They might have some predisposition to stress responses and negative stress responses. We're not quite sure what's going on yet, but this is time for us to really start talking, because we have enough data under our belts to really start talking about what we're going to do to change what's happening.
Absolutely. You definitely need to have the caregiver mentality.
Yes.
And that I know is definitely a risk. And you need to be really aware when you're in a caregiver position.
Yeah.
And like you said, the caregiver professions.
Yeah, and I think it's specifically for compassion fatigue. You know, you can't put yourself in the place and face of suffering without having a human response, because we're human beings doing really difficult work. So compassion fatigue is something that we should all be educating each other about and be aware of how it manifests in us and in our teams. But compassion fatigue doesn't necessarily mean that you're going to manifest depression. It doesn't necessarily mean it's going to turn into a suicidal ideation. And so what we really have here is a sort of a slippery slope of psychological distress, and being able to recognize early warning signals, being able to have really open conversation with colleagues about when we are really struggling and what kind of support we have and what we need to better cope is critical.
So when I ask my team or my colleagues, are you okay? And then tell me, no, I'm not okay. What do I need to do? How do I help?
Oh, that is such a scary response, right? And that's one of the things that keeps people from asking, because they don't know what they're going to do if that's the answer they receive, right? And most of us, let's be honest, when we pass each other in the back of the house, what we say is, no, I'm fine. Yeah, I'm fine. Yeah, I'm good. Even though we're not. And so being able to recognize that, A, once in a while you're going to get a nonverbal signal that tells people that something's wrong. And it's not going to mesh with what people are actually saying. It's not going to actually, go together with what's coming out of their mouths. But also, if you're really concerned about somebody, and you ask them what's going on, I'm really worried about you, and they start telling you that they're really in trouble, what do, right? So the model that we train on at NC State University is QPR. It's question, persuade, refer. And it's based on the idea and the research actually that community intervention, community prevention is more effective than anything else we have. So you don't have to be a mental health expert to have these conversations. When we say to someone, I'm really worried about you, are you okay? And they say no, then the best thing you can do is get to a quiet place with them and say, I'm really concerned, tell me what's happening. It doesn't mean you have to fix it. It doesn't mean you're going to know exactly what to do, but it does mean that you need to open the conversation so that someone has someone to talk to, that you are portraying that you're trustworthy and that you care enough that you're going to follow through. When people are feeling really desperate, they are incredibly isolated and they believe that there is no possible solution to the pain they're in. And so one of the ways we can prevent someone from taking additional action is by talking to them. So, what can I do for you? Are you getting help? Can I get that help for you? Can I take you somewhere? And then following up and constantly checking in and saying, how's it going? Have you followed through? Are you seeing somebody now who can walk you through these processes? Is anything improving? Can we just meet for coffee? Just being a good friend, a good colleague, and a concerned human being is one of the best protective factors we've got.
And I agree with you that our normal response is no, I'm fine. Mm-hmm. And so when we reach those people and we're seeing those the snapping at colleagues, we're seeing the frustration with patients or clients. How do we persuade? How do we do that portion of it? How do we reach out better?
Yeah. So one of the things that I frequently do when I'm working with my colleagues is I'll say, here's what I've noticed, and you're not yourself.
Ooh,
I've noticed you're not yourself, and I'm worried that you're not yourself because it looks like it feels to me like it's been building up for a while, and that really worries me. And will you tell me what's happening? And can I help? Can I support you? Because I want you to feel better. You're a really important member of this team, and I enjoy working with you, and I'm concerned about your well-being, and we need you here. Because people need to feel important. They need to feel like they're seen. They need to feel like no matter what they say to you, you're not going to be shocked and you're not going to run away. And so I often will say, it's okay for you to tell me what's happening. It doesn't mean I can fix it, but I do want to know. I want to know. And then it's really important to get help because I care about what happens to you, and I don't want anything bad to happen to you. And I think for most of us with our colleagues, that's true. We don't want to see anything bad happen. And so that's probably the most important message we can get across.
Excellent. Well, I want to thank you so much for coming in and talking to us. Is there anything else that you, a final tip about balance that you want to leave us with, that like final nugget of wisdom?
You know, all of us work so very hard and are brought to this profession with nothing but passion and a desire to be of service, and ultimately that undergirds everything that we do. And I think if I could say one thing to my veterinary colleagues, it would be you can't serve from an empty vessel. So we have to be doing a better job of caring for ourselves so that we have all of our best tools on board. And that is the best service we can do to our clients and patients.
I think that's incredibly good advice. Thank you so much for sharing that with us and for coming.
Thank you so much.
I look forward to your lectures tomorrow.
Thank you.